All right, ladies and gentlemen, we're going to begin our weekly update. We've done some shorter updates where I update as the town manager. But right now, we have our entire emergency management team in place. We're using the beauty of some technology. We do have our school superintendent available, THEA STOVELL, will be joining us live via Zoom. THEA, how are you?
I'm good. How are you?
Good. I wanted to give you an opportunity to update the residents as to what's going on with the Randolph Public School, with education, with the food options that you've been doing an excellent job with. Take it away.
Okay. Well, thank you. I hope everyone in the community is doing well and being as safe as possible. I want to let you know that education remains a priority at Randolph Public Schools. Our teachers are working every day preparing daily lessons for our students. Our related service providers are also providing support to our students with disabilities and doing social emotional check-ins with families to make sure that everyone is doing okay. We have been in touch with almost all of our families. There are 20 families throughout the district that we have not been able to get in touch with and are doing more intensive searches to make sure that we can locate these families and make sure that everyone is okay. There have been questions about our students with disabilities. I want to inform everyone in this community that our students with disabilities are receiving the services that can be delivered remotely or virtually. And if there are any questions, please reach our special education department. As we wait to hear from the governor as to whether or not our schools are going to open on May 4th, our teachers are preparing to move towards more live teaching, and you're going to hear more about that. Our families are going to receive information over the weekend and as early as today about other options that our teachers are using to engage students in the work that we have going on. I just want to give a few statistics of what's happening right now. We have delivered devices to over 490 of our families. Over 48 hotspots, the Wi-Fi boxes have been delivered to families. We also have delivered devices to some of our homeless students who are in Boston and in Middleborough. 97% of our secondary students are logging into Google Classroom. 80 to 85% of our elementary students are also logging in as well. We have 50% of our students overall who are engaged in the work on a regular basis. And we have a team of people that are working to increase that number to get more students actively involved. Over 850 inquiries have come into our IT department and to receive support on technical technical assistance. So again, we're looking at that. And trying to respond to everyone's needs as we work. I do want to give a huge shout out to the RPS employees, the educators who are working extremely hard to make sure that they can provide services, and the administration who are stepping way above and way outside the scope of their normal job descriptions just to make sure that we are servicing students and their families. A couple of other things I want to note. You mentioned the meals. We are right now serving anywhere between 12 and 15,000 meals a week. We've gotten questions about why we've switched to the prepackaged meals versus the meals that we were using before. We are trying to go back to providing some of the more fresher type meals and the fresh produce. The concern right now because of COVID-19 is that prepackaged is safer for everyone. It's safer for the person receiving the meals. It's less handling on our part. We have had to deal with some of our staff becoming ill, and so we are just trying to keep everyone safe. So the less we're handling the food, the safer it is. It comes straight from our distributor to your table, so we're trying to minimize that amount of contact and keep people as safe and as healthy as possible. Another thing is the school committee voted last night to change the school calendar, so we will now be working through the April vacation. With that being said, Monday, April 20th, Patriots Day, we will not have remote learning in place. However, assignments will be online. I know for some families, this is going to create some anxiety. You're looking forward to the vacation. The rationale behind the decision was basically that we know right now people aren't traveling, vacations that were scheduled aren't happening. Remote learning is really kicking up, and we see the momentum with our students. So we want to keep that momentum going. However, if you are feeling anxiety, need to take a break, do so. This is not meant to create stress in what is already a very stressful time. Do the best you can. If you can't, reach out to teachers, let teachers know so that we can find ways to assist you. But again, do the best you can. That's all we ask at this time. And then lastly, I just want to mention two things about our MSBA program around the Lions School. We have a school building committee in place. We're looking for people of the community who may have a background in construction, architecture, engineering, anyone that may be interested in being a part of the school building committee. If they could reach out to my office, superintendent at randolph.k12.ma.us, or to our school committee chair, Miss Andrea Nixon. We are interested in having people become part of that team. We are in the middle of, or in the beginning phase of our feasibility study. And so we're really looking forward to getting started on that Lions project. The other thing that's happening is the Lions Envision in Education. We are trying to put forth a series of about 5 virtual meetings, and we're looking for members of the community who are interested in talking about what a future Lions program could look like. So again, if you're interested in being a part of that, please email my office, superintendent at randolph.k12.ma.us. I think that includes my update for now, unless people have questions that are coming into you, Brian. I just want to tell everyone to stay safe, and we will get through this as we try to get through everything else that's coming our way. And it remains fluid, and so things are changing regularly, but hopefully we're doing the best. I've gotten a lot of positive feedback from families, and I will say I'm very proud of Randolph Public Schools. We really jump-started this and are in a pretty good place compared to what we're seeing in some of our other districts.
I want to echo that. There's no question that talking to folks in other communities and even some parents who have been posting on social media, the Randolph Public Schools was online, if you will, quote unquote, with Google Classroom and online learning 2-3 weeks in advance of some other districts. That is a testament certainly to you, to the administration, your tech team, top notch, and the teaching staff. To be able to pull that off in the time frame that it was pulled off is very, very impressive. There is a question, and I'm assuming this deals with, it talks about our stipends being paid. I'm assuming that's in relation to sports stipends and things of that nature. At this point, we have no idea if sports are going to occur. We don't know if school's going to occur. If I was to make a prediction, and this is nothing more than a prediction, I want to make it clear, based on the standards being set through the federal government, and most of the governors agree with looking at 14 days of testing numbers going in the correct way, that I find it hard to believe that school is going to start back up. But anything is possible. But I suspect that Governor Baker's announcement will probably be that school is not going to step up and start again. Any comments on that?
What I would say, Brian, is that I've been in on regular meetings with the commissioner's office. No decision has been made, so we're waiting to see. There's a lot of talk right now about what it looks like going forward. But what I would say is, right now we're planning as if we were coming back May 4th. It doesn't look like that's going to happen, but we don't have any definitive answer. I was told that there might be something coming from the governor's office later next week.
Yeah, that's what we're hearing is sometime the beginning of the week that the governor's office is going to make a final determination. But when I do look at the physical distancing and the roll-in of going back to whatever the new normal is going to be, it is hard to believe that the settings of a school classroom are going to meet that standard. But we'll have to wait officially to see that. I want to make it clear that's just my personal opinion based on what I'm seeing in directives coming from both the federal and state level. So on the stipends on coaching at this point, I'm assuming that until you know whether or not there is going to be sports, that the stipends are on a standstill at this point.
Yeah, I mean, we're going to have a conversation with the union around stipends, but what I would say is that, if sports were to start up, we probably prorate based on what happens.
The length of the season.
It's hard to make a decision. I mean, if they don't happen at all, I think we'd be hard to justify paying out stipends for work that hasn't happened. But again, the MIAA has extended or sort of shifted the time frame for sports, so they pushed it back well into the end of June.
Right.
So if schools were to reopen, most definitely we would re-up our sports programs and would pay out for the necessary programming to make that happen for our students.
On the idea of graduation, the ceremony, the event, again, we don't have enough information at this point to really know what options will be available. Some colleges have actually already canceled theirs. A lot of colleges happen in May. What kind of conversations are occurring in that area?
So Brian, some of the things that we're talking about for graduation, and again, this is heartbreaking, particularly for me. I've got two seniors at home, a high school senior and a college senior. So I understand as a parent, and I also understand from the perspective of my children, what it's like to not have all of the festivities that come along with senior year. So we are looking for ways to acknowledge our seniors. And I got called out last night because I keep talking about the seniors and not our 8th graders and not our 5th graders. And although I think those are important times too, it's not their final time. And so we will look to do something for all, but I'm really looking for the seniors. So I heard that Randolph used to do parades in the past and seniors were on floats. I don't know if you know anything about that, but that's one of the options we're looking at, is that we could practice social distancing and maybe organize some sort of parade up Main Street where we acknowledge our seniors. That's one thing we were talking about. There's a lot of virtual graduations popping up online right now, so we're looking at that. I'm really going to rely on the high school principal and his team to kind of find ways that they can celebrate their seniors. So we are looking at that. Other districts are talking about a July or August graduation date. Some have even pushed it to Thanksgiving when kids are coming back home from college and home for Thanksgiving. I got to tell you, that doesn't sit as well with me because by that time we are full swing into another school year. It's a tough time with families trying to prepare for the holidays. There's also all the Thanksgiving football games that may occur. So I don't see November as being a time to celebrate that, but I'm not closing the options for anything right now. So we're open to any great ideas that people have to celebrate our students who are moving up.
Yeah, I would agree with you that the focus much more so should be on the 12th grade class versus the 8th grade or the 5th grade. Those are, they're just, I agree with you, they're not the same. Having been through them both as a parent and as a student, it's a completely different situation. So thank you for joining us remotely. I know you have some other meetings that you're going to be zooming into. It is amazing that technology that we're using now, I'll be curious to see, even after everything is relaxed, quote unquote, how technology factors into what we do. There's no question that it has been great to not have to travel to certain meetings throughout the state now that you can just Zoom in. So I'll be curious to see where we go from there in that regard. Thank you for joining us. Thank you for doing a good job. And there were some additional questions. Some of them you had already spoken about. We did have the email address, and I noticed that somebody else put it up on the feed. People should email you directly some of these questions that they're looking for some specifics on. So.
Okay.
And somebody asked, MCAS is canceled statewide. My understanding is that is 100% correct.
That is correct.
Okay. Thank you.
Thank you, everyone. Be safe and be well. Take care.
Thank you. Jerry, I think next topic for us to discuss today, without a doubt, is our public health response. I do want to address the issue of the Mass Department of Public Health released some data last week. I'm sorry, feels like last week at this point. Every day feels like Groundhog Day here, the movie. But on Wednesday, they released data, and they did so in creating a 100,000 resident standard. Randolph does not have 1,000 residents. We're give or take about 33,000. So a lot of media outlets had put us at 1,072.5 residents, and that confused everybody. I mean, from social media to phone calls here at the town hall, texts, emails. And I think this has been the frustrating part, is data is only as good is when there's context applied to it. And to release data without that context, I think, was a disservice. And also, they didn't reach out to any of the communities to let us know this was coming. So we knew where we compared to a few of the towns around us, because they had been releasing their data as we had been, but not every town had been. So we knew that in particular with Braintree, similar in size, that we were greater than them, but not enough that I would say that it was raising a red flag. In seeing this data, it didn't factor in a number of things. It didn't factor in communities that have long-term or nursing care facilities, which Randolph does. Give or take, 20% of our number is tied specifically to that one location. And that's a location that's in lockdown. That's a location that those residents are not integrating into the regular population. They're not at Shaw's. The community transmission is just not there. In addition, they didn't factor in the density of a community. Most of the other communities have density that's in the top 10 of the state, population per mile. Randolph is 55 to 56 in the state in that area. We're a much different community in that regard. It didn't factor into the nature of the workforce. There is no question from the work that your office is doing and the tracing of the individuals that are confirmed positive, that folks that work in the nursing and healthcare industry and frontline workers, these are frontline workers, folks that work in the retail trade, and folks that work in particular on social services. These are overwhelmingly positions that folks in Randolph are employed in, based on census numbers, based on the phone calls and the tracing that your office is doing. And these folks are on the essential list. They have to go to work. They are meeting significant demands for services that are out there in the public. I certainly cannot say enough for them that they are going to work every single day and doing so in this pandemic to provide a service. So that was the frustrating part for me, was the lack of context to the numbers. What are your thoughts as the health commissioner for the town? Where do you see these statistics, and how do you interpret them in that regard?
Sure, Mr. Town Manager. The way they release the data, this is data that we've been asking for as public health officials early on in this crisis. We didn't expect to see it come out the way it did in the 100,000 per capita basis. We were asking more for what would be an average per every 10,000 people. What would be above average? What would be below average? But you know, any time that we get data, we are grateful for it. It's just the way it was provided out to the general public. It was very informative for us as a community, but I think it could have been given to us in a different format. But just to touch base, there have been 32,181 positive cases throughout Massachusetts, and up to this point, 140,773 people have been tested. So with that, there's a ratio of 22%, about 22% of those that are tested test positive. So keep in mind, in order to get tested, you have to have certain symptoms. You have to have a cough, you have to have sore throat, you have to have a tightness in the chest, you have to have a fever, and you're asked by a physician, and it's through a screening process to see if you qualify to get tested.
And I think that's where, again, the context issue came up, because they're releasing the numbers as of January 1st, and it's a good number to know, 367, excellent. But what is the number of recovered individuals and those that are hospitalized? Because everybody reacts to the virus differently. So in Randolph's case, our recovered numbers are closing in on 70. Of the deaths that occurred, 5 out of 6 are tied to the nursing home. Again, context is critical. Less than a dozen of the individuals are actually in the hospital. Most folks, knock on wood, that have been impacted in Randolph have been able to manage their symptoms from home. And that's an important statistic that's missing in this conversation. And that's why I was certainly disappointed in the fashion of how the state chose to do it. The good thing is that they're now taking some of our requests more serious. I know that you had requested previously a pop-up testing option in Randolph, and we were meeting mostly closed doors. And now with this data, we have some ability to make that potentially happen. Can you give an update as to
Sure.
that?
Yeah, so late yesterday, I was able to send a letter to Kelly Driscoll. She's the COVID-19 Command Center Director. It's part of the Executive Office of Health and Human Services. And Ms. Driscoll responded back right away this morning. We were setting up a Zoom conference call with some other public health officials at the state level, and also through various community health organizations. And part of that conversation this afternoon will take place as to where, when, and how we'll set up a testing center in Randolph. So we don't have all the details right now, but when we do, you'll be informed as to what the next steps are. And some of my concerns were for those folks that may not have a primary care physician. How could they have the ability to get tested? And that's going to be part of our discussion later today.
And one of the things I know that I have spoken to you about, based on the data that's been released from the state, based on looking at that data, is in talking about the density issue, Randolph is predominantly 80% single-family residential homes. So when the contact tracing conversations occur, we've not had folks request the ability to go to, say, a hotel setting they prefer to be at home. I didn't find that surprising because we've had snowstorms and blizzards and power outages that have gone on 2 weeks in the past, and we opened up our shelter, and only 2 or 3 residents would actually take part in that shelter as far as staying overnight. Some folks may come in during the day to have something to eat. So I'm not surprised that people choose to want to be home. That's what I would want to do too. So one of the hopes that I have with this increased testing, because of people that are asymptomatic, if the person, before they can come off the list, it would be great if we're able to test the folks in the home, because they could very well be asymptomatic. I believe that would be a great benefit, not just to Randolph, but to any community as they increase the testing capacity. What's your thoughts on that?
Yeah, no doubt about it. It's the asymptomatic folks that we want to contact. If they came in contact with somebody who was contagious, we want to make sure that they know that they should be in quarantine. They need to be out of the public areas. They need to self-quarantine for 14 days. And that includes you can't go to the grocery store if you're in quarantine. And getting back to Brian's point about testing, being asymptomatic, that's something we'll discuss this afternoon, and especially you'll need to get a physician involved for that.
And that's the hard part. This is really a national conversation on the amount of testing that is available and how that impacts the reopening of the economy, of government. I think that ultimately the ability to have widespread enough testing that you have the capacity to do folks that are asymptomatic is critical to the future opening up of government in general. I think that right now, because even though we've been able to, in Massachusetts, a significant increase in the ability to test, but most doctors are trying to weed it out to just folks who have symptoms, because we're not at a point where folks that are asymptomatic have the ability to just have the test done. So this is a considerable conversation. I know we have a meeting later today, and we're going to have a continued conversation. I do want to mention my thanks to the MRC, the Medical Reserve Corps. I want to thank the Resiliency Committee. Liz is going to speak a bit about that in a few moments. One of the things that folks have asked us about is food security. We have been able to, by the Resiliency Committee, by the MRC, through our food pantry on the Resiliency Committee. You have Natasha Clerget, who runs a program on Thursdays. We have Ryan Egan, and we have Debbie Batson. Debbie is the, I don't know if she's the president of the food pantry, but she's certainly in the top leadership roles over there. We've been able to, so far, navigate our way through this issue and to provide assistance, not just to those that have been tested positive, but for any resident because of the economic situation. We were going to have a food drive this Saturday. However, we were able to raise so much money and food back a few weeks ago that some of the food is actually being stored at the community center at this point because people have been so generous. So I had a conversation with the Attorney General's office, Maura Healey's office called the other day, our state reps, our senator. When and if we're in a situation that we need state assistance on food, that door will be open to us. But knock on wood, our Resiliency Committee, our Medical Reserve Corps, and our food pantry have been able to continue to assist residents in that area. Jerry, one thing we're going to be doing, and we're going to be announcing it to the businesses later today, is a face covering order, not an advisory for the businesses, but an order. Can you speak to that?
Oh, certainly, yes. It's an order from the Board of Health about face coverings. So I can read some of the context of it. So whereas it is known that the disease transmission primarily takes place from the aerosolization of respiratory droplets, meaning breathing, coughing, sneezing, of a symptomatic or asymptomatic person. The community of Randolph is taking the following precautions when in public places. So effective Saturday, April 18th, every individual should wear a protective face covering at all times when in public. This mirrors the CDC's recommendation as well. So a protective face covering is defined by any cloth material, such as a bandana, scarf, handkerchief, or a mask. So here I have some examples. These are cloth masks. They're made here in town by some volunteers, and we have other, it's a tailor in town, I believe, that's able to provide some of these masks. But like I said, it doesn't need to be a hospital-type mask or a medical mask. We want to save these for first responders. We want to save these for medical folks. But any type of cloth covering will help prevent the spread of the disease. So in addition to all that, all businesses that are deemed essential under the state order from March 31st, 2020 must adhere to and comply to the following requirements. All grocery stores, retail stores, food service establishments must wear protective face coverings. Gloves must also be readily available and in use. All entry doors must be posted advising customers that face coverings and social distancing, a 6-foot separation, as you know, must be maintained inside and outside the establishment. The establishment staff must supervise and help enforce this requirement. So for staff, establishments must increase employee illness surveillance. That means checking in on them, continuing to ask staff if they've been exposed to COVID-19 or if they've been put in quarantine. They need to not be there. They need to be in quarantine. Ensuring employees don't come off of work and not come to work when they're ill. So stay home if you're sick and call your supervisor about that. And we also recommend that you take a daily temperature of your employee at the start of the work shift. We're doing that internally too with some of our staff. And daily surveillance should be recorded with staff noting the employee and the position. So local businesses not adhering to this requirement could possibly face fines, but this is something we'll get out later today.
Thank you, Jerry. And what we're trying to do here with the face coverings, and that's the key. Not everybody has the direct access to a mask or and when I say a mask, there's no question that we want to save the N95s for the medical professionals, for the public safety, for the police, the fire. I mean, our fire department, they're paramedics. They're going into the homes to provide medical care and transport individuals. But if we can get more people wearing masks in the shopping and retail settings, that will help. If you're wearing a cloth mask, you're protecting the people around you. I don't think it is unfair for us to then request that everyone in that setting wear a mask, a face covering, to do what's possible to help reduce the spread. So that is an order that will be going out. There's no question that this will impact the businesses more than anything, and these are businesses that have already been deemed essential by the governor. So we certainly encourage residents when they're walking or if they're in a general public area to have face coverings. However, I don't think, A, that it's enforceable. I don't think that the police department is in a situation to be driving around town and pulling over to talk to people who are walking by themselves and don't have a face covering on. I think that that's not where we're at. However, in a setting of of an essential business that's remaining open, I think it is critical, and for the food establishments, I think it is critical. So that will be on the website later today. The Medical Reserve Corps and your office will be delivering these notices to the businesses, and we expect compliance. They've worked with us so far on everything that we've asked, so I'm anticipating that that will go well. I want to make sure, based on some things that I've seen on the Facebook feed, we are storing some of the extra food at the RICC for the food pantry, but you still go through the food pantry to receive the food. So the food pantry's on Mondays. The Concerned Citizens of Randolph drive that's on Thursdays. You still go through what I call the trusted partners. And I think it's important that we run our things through trusted partners, people who, even before this emergency, had been providing a critical service to residents in the community. That said, if there's an emergency situation and you did not go either Monday or Thursday, and there's an emergency situation, you should email or reach out to the RICC, and they will do what they can to provide that service in the meantime. But the Monday and the Thursday is still the method that you should be using in dealing with food security matters. And we're going to continue to work with all those trusted partners, and I just can't thank them enough. There are a lot of folks who are really stepping up to help fellow residents, and it's really been wonderful to see. Question about youth sports that I saw. I know Randolph Youth Softball Baseball has, in fact, canceled their spring season. Soccer, at this point, has not made that decision. I think they're waiting to see what the medical advice given by the state is. So at that point, soccer, we do not have an answer as to what their plans are. But once we find out, we will make sure that we get that information out to the public. Jerry, I know we talked on a series of topics. I think we hit the majority of the topics. Is there anything that we missed?
Yeah, I just wanted to bring up a few more points. So we spoke about the contact tracing. So that's if you are a contact, we would get a call from a Board of Health, a Public Health Department staff member, and if you do get a call, please, please, please try to cooperate. Sometimes we get people that are suspicious about why we're calling them. Sometimes we give them a number and they call back. But this is really for everyone's best interest. Please cooperate with us when if you receive a phone call, it seems like a strange number. We're calling to protect the community, and we're informing you about potential exposure. So it's really important. We call that the contact tracing program. So one other thing I wanted to touch base on is we sent out a notice to the multi-unit building owners, so the apartment complex owners and property managers. We gave them some tips from the Centers of Disease Control about how to better clean and disinfect the buildings, especially the common areas, hallways, elevator areas, mail room, laundry room, any place where things are touched often. It's really important to help control this disease, to increase cleaning and do effective cleaning. And also try to limit visitors coming into these public places. If you, we do not want to see large groups of people. We all know that. It's all about social distancing. This is what we still need to do, and we need to continue with this. And so really, social distancing is the most important thing we can do right now. And those are my updates, Brian.
Thank you, Jerry. One quick question on the tracing factor. It used to be 24, and now it's gone to 48 hours. Just real quickly, the governor's talking about the tracing that they're hiring people to do, and then there's the tracing that you folks have been doing. Are they going to contact people that had been originally tested, have come off, have met the standard, but then ask them to go further back?
Okay,
where does that exactly stand?
And so what you're hearing is when you're in close contact with somebody who is a known case, who, when we first started this contact tracing, it was always the day of that we knew that the person interacted with somebody who was potentially infectious. So right now, we're going back 48 hours or 2 days before. We don't count the number of hours. We look at the calendar, and if there was a contact interaction on Wednesday, or we know that somebody was potentially exposed to a confirmed case, we would go back to Monday and see who that person interacted with on Monday. So we've added an extra 48 hours to our contact tracing.
And is the governor and the folks that they're bringing in, I guess my question is, where are they just going to back up
Oh, sure.
with the list that you have, or are they doing additional?
So, Brian, that's another one of our conference calls we're going to have this afternoon after, that's going to be at 5:30 today.
Okay.
And so that's with a group, the contact tracing group. So right now, we're working with the state on a group of folks from Red Cap. Red Cap, they're a trained public health specialist, and they help us interview the Randolph residents that are positive and also help us trace back the contacts. There are 6 people in Red Cap, and they have 1 supervisor in addition to our own staff. With this new contact tracing program, the state is hiring, I've heard, up to 1,000 individuals to help cities and towns across the Commonwealth to trace people. And this is a service that it's going to be kicking off soon, and I think Randolph's going to be one of the first communities to participate in this.
Thank you, Jerry. I do see a number of comments in regards to face masks and face coverings, and most of those will be in the advisory. I will say one of the questions was, is it proven that cloth coverings do anything? Sneeze and cough particles go right through. I think the CDC and I think the state government, we're in no way suggesting that a cloth mask has the same components as an N95. What we are saying is that it does help limit. If I sneeze and I have a cloth mask on, the amount of particles is going to be significantly less than if I don't. I mean, that's common sense. Is it the same as having an N95? Absolutely not. But is it a way to try and reduce? It absolutely is. And no system is perfect when it comes to this. How you have the mask, the type of cloth that you use, how you wear it, all plays a role. But anything we can do as a community to help lower that, we want to try and do it. And that's all that is about. Thank you, Jerry. If you do want to join the MRC, how do people join?
Well, certainly, you could contact our office, and you could also contact the MRC directly. They have a website, MRC, it's the SHARE, the SHARE-MRC.
Thank you, Jerry. I truly appreciate it. At this point, we have our public safety chiefs here. Chief Pace, if you could provide an update on the police side.
Thank you, Mr. Howard. I would like to, first of all, thank the members of the Randolph Police Department for adjusting so well into our new normal. I'd also like to thank the members of our community that have generally followed our instructions and called ahead prior to any service they may need, so we do appreciate that. But we are seeing some scams pop up. Yesterday, actually, when the government issued checks, we're starting to see people get phone calls and emails from people who represent themselves as the Internal Revenue Service asking to verify their personal information. This is, of course, a scam. The IRS will not call you. Neither will Social Security. The government will not call you to verify personal information, and that goes for any other type of inquiry, whether it's text message or email or whatever. The other thing we're seeing is the price gouging and hoarding of personal protective equipment. Many times, people will be called to buy this personal protective equipment at a premium price. We're seeing some of that. And also the regular scams like work from home scams, online dating sites, apps, and lottery payment scams. Just, you have to really use common sense during this time. People are, I mean, a lot of times desperate for money, and they'll use any means necessary to separate you from your money. So we just ask you to be very careful. If you have any questions or would like to call us to check something out, we'd be happy to take your call.
Chief, on the price gouging, I know the Attorney General has talked about this. That is something that is enforced through her office. What I have suggested to folks who have seen some of that, luckily not a lot of it, but there has been some, take a picture of the sign so you can indicate what the charge was, and you email that to the Attorney General's office because they are the enforcement agent for that. Is that accurate?
That is correct. Anything like that would go through the Attorney General's office. However, we're also seeing some scams where they're selling personal protective equipment out of a trunk of a car at a premium. And it's the classic larceny by false pretense scam most times. So just don't do it. It's just not worth it.
Generally, if somebody is asking you to purchase something
It's never really what it's cracked up to be.
from the trunk of their car,
Yeah.
it's probably not the best deal,
Nope.
and it's probably not safe, and it's probably not even what they're recommending that they're purchasing to and selling to you. I think the key message is, and this really doesn't just hold for now, but it really is, whether it's on Craigslist or the social media sites or trading sites, if the deal sounds too good to be true, it probably isn't.
It's
and
not
that
true.
has been true. I wish I could remember when I was a kid in the 70s, there was a show, I think David Horowitz used to have a national show, and he used to talk about that. Folks, if it's not a trusted partner, if it's not a retail organization, do not, absolutely, in any way, shape, or form, partake. Do not ever give out a bank account number. We sometimes see that with some of the vulnerable populations in Randolph, and it's heartbreaking because trying to get those funds back can be very difficult.
There's also another scam that we're seeing a little bit more of lately is the blackmail scam, where they'll try to contact you through email or through text and say they have information about you that they want to impart to the world, but they won't if you pay them enough money or if you buy them a Bitcoin or something like that. Those are all scams. What you do is just delete the email, and if you think they have any of your passwords, change your passwords, and you should be all set after that.
Excellent. Chief Donovan,
Good morning,
how are we
Mr.
doing
Howard.
on the fire side?
We've seen a significant rise over the past week in our request for medical aid with regard to the COVID-19 responses as we've entered the surge, which has been noted by the governor and the Commonwealth. We continue to work closely with MEMA in obtaining PPE and with our partners in state and local DPH for guidance with regard to appropriate protocols with regard to our protection and the most up-to-date procedures for handling patients affected with the virus. Also, along those lines, I'd just like to take a moment to thank our firefighters on the front line who are dealing directly with the patients affected with the virus on a day-to-day basis. Also to my ad hoc COVID response team, firefighter Jack McCarthy, who is a member of the Massachusetts Hazardous Materials team, Captain Tom Banal, our EMS director, and Chief of Operations Ron Casford. As a group, these gentlemen have been working tirelessly on addressing the issues of dealing with the COVID-19 as it relates to establishing networks for PPE procurement and addressing the best practices for our department to follow for the protection of our first responders and the public we serve. On another note, our buildings are closed to the public, as I've discussed before, but all of our administrative services are still in effect, 100% code enforcement, fire prevention, what have you. You can reach us for any non-emergency services at 781-961-0991 or randolphfire.com. Thank you.
Thank you, Chief. And again, to echo your comments, an excellent job by our public safety departments and the work of our folks on the ambulance and going into those situations. Thank you. Last but certainly not least, our Director of Library, Community Program, and an RICC, Liz LaRossi. Liz, you folks have been doing some pretty neat stuff down there.
You made me last because you know how long-winded I am. So I've got several reminders. I'll try to talk fast. Library and RICC, they're both still closed, but they're fielding calls from 8:30 to 4:30 Monday through Friday. Don't forget to check out the library's website, turnerfreelibrary.org, for a plethora of digital resources, including books, music, movies, classes, job help, homework help, and more. If you don't have a library card, you can sign up for one on our website as well. It is free and easy. All due dates on materials have been extended through May 20th, so please stay home. Don't forget to follow the library and RICC on Facebook for a wide variety of free virtual programming, including book talks, at-home workouts, story times, which we've had some first responders participate in, which was really fun, science experiments, and so much more, all to meet your informational, educational, and recreational needs from the comfort of your home. Again, please stay home. A note on the cloth masks. Our library staff has sewed over 300 so far for town volunteers and posted a video with instructions on how to make your own to our YouTube site yesterday. The library would like to help everyone socialize while physical distancing with our first fully virtual Randolph Reads program. To participate, read any book by National Book Award-winning author Jacqueline Woodson and join all of Randolph in an online book discussion on Thursday, April 23rd at 5 p.m. Woodson is the best-selling author of numerous books for kids, teens, and adults, with some of her notable works including Another Brooklyn, Brown Girl Dreaming, Red at the Bone, and Miracles Boys. Turner Free Library cardholders can borrow a range of Woodson's books and audiobooks for free online through our digital collections. Registration information and links to the book titles are available on our website. All Randolph residents are invited to join us for this virtual discussion. Let's come together as a community. Again, this is April 23rd at 5 o'clock. Did you know that it's National Poetry Month? I think everyone else has more things on their minds right now, but it is. It's National Poetry Month. The library is holding a poetry/creativity contest throughout the month of April. Check out our website for details and to submit your original story, poem, song, image, or video for a chance to win. And don't stop there. The RACC will be posting info on its annual art show this weekend, and we're going digital this year. Stay tuned. I would like to remind our seniors that elder services are still fully operational out of the RICC. We're providing senior rides, and our outreach worker is busy keeping his clients connected to food and resources. We will begin call-outs to all seniors in town next week to check in and make sure everyone is getting the resources that they need. The Randolph Recreation Department delivered treat-filled eggs to over 200 children on Saturday, April 11th. The Easter Bunny, along with a small crew of town staff, stopped at over 100 Randolph homes, did some silly dancing, and left a treat for kids on their lawns. The registration for this event was filled in under 24 hours, and the community feedback afterwards was amazing, including Facebook posts with kids' noses pressed up against windows, thank you emails, thank you notes on windows and in chalk, and even a painted thank you egg from one family. Randolph Recreation plans to implement this event annually and to expand upon it, allowing for additional registrants next year. Thank you all for your wonderful comments. It was great to see you from a distance, of course. The RICC hosted a very successful blood drive last Wednesday. It was planned in December, and we decided to work with the Red Cross and our public health department to ensure that it was able to still happen. Due to COVID-19, many blood drives have been canceled, and there is an urgent need. Only those who registered in advance, and it was booked up well in advance, were allowed in the building. Temperatures were taken, everyone was gloved and masked, and all protocols imaginable were taken to ensure this was a safe and effective blood drive. We want to thank Health Director Cody for his continued guidance on this and many other matters. The Randolph Resiliency Committee is seeking volunteers. We have several committed volunteers who are already helping with events around town, such as our very successful food drive 2 weeks ago. They're helping at the food pantry, grocery shopping for seniors, helping with unemployment applications, and more. We're looking for more volunteers, however, and especially have a need for volunteers who are fluent in multiple languages. Please reach out to randolphresiliencycommittee@gmail.com if you would like to volunteer your time. If you are in need of assistance during this stressful time, please contact us at the email address mentioned, or contact us at 781-961-0930, extension 113, and our volunteers will assist you. Also, we were planning that food drive, as Town Manager Howard mentioned, for tomorrow. However, the food pantry is fully stocked, so we're going to hold off for another week or two to make sure we're timing everything correctly. Finally, I want to mention Randolph Townwide Cleanup Day. Normally a day where the community comes together to clean up Randolph. This year, our annual cleanup will take place asynchronously. The cleanup had been scheduled for April 25th. However, due to COVID-19, it is unable to occur as it has in the past. This brings a new opportunity to Randolph to reach more people and create more community stewards, as volunteers will now be able to clean up Randolph in their free time, not just one set day every year. Anyone in town is welcome to volunteer. However, the first 100 registrants will have buckets, gloves, and grabbers dropped off at their doors. We've had 105 people sign up so far. Some are families, so the number is much greater than 105 actually. Participants are asked to collect trash around town from April 25th to May 2nd and tag the town on social media with pictures of their progress. However, registrants are also encouraged to hold on to their buckets and grabbers and continue to be green community stewards by cleaning up their neighborhoods year-round. Be sure we are physically distancing during this event, everyone. Sign up via our registration link on Facebook or by emailing me at elarosee@ocln.org with your name and address. Thank you.
Thank you, Liz. And I'm very excited about the program. I do think that in delivering the buckets, the pickup buckets, the grabbers, I think there are a lot of folks in town who have been doing great work over the past month in helping to beautify their neighborhood, and this will assist them in doing it. I want to thank them enough in the idea of beautification. Gloves, the situation is better than it was, but we still have people that shop and drop their gloves. It's not fair to the businesses. It's not fair to the residents. It's not fair to the environment. It is getting, after it's wind blown into our sewer system. Folks, do the right thing. If you're going to wear gloves when you go shopping, dispose of them appropriately, and we're going to continue to. And if the police find, notice you're doing it, you will get fined. So it is not appropriate. Face masks, thank you on the 300. I will say to the residents to reach out to Liz if you want to donate masks. We are trying to get masks to our senior complexes in particular, and then once we get those, we'll try and get further out to the community who may not have the ability to make their own face mask. So please keep an eye on that, but if you have any to donate, please. Yes, Liz.
If anyone has any, we have enough material right now, but if anyone has any elastic they would like to donate for us to be making these masks, if you want to put it in a bag and put it in the book drop at the library, then we would gladly take your elastic donations. Thank you.
Thank you. As I end every one of these sessions, the 2020 census, we're unable to do some of the events we wanted to do because of the physical distancing, so please, answer your federal census. We have the information on how to do it digitally online, my2020census.gov. In addition, we have the phone numbers on the town's website. You can actually do so by calling, and they do have a number of language assistants available. So please, your census, it is critical, as we're seeing now, when these federal monies trickle down to the state and then trickle down to the community, we need to have the best census numbers that we can that accurately reflect all of the folks that live here in Randolph. Finally, go to the town's website, sign up for the town news, sign up for the HyperReach notification system. We want to be able to communicate with residents in a whole host of different ways. We sent out a postcard that went to every home back about a week and a half ago, and we're going to be doing another mailing. But in those times of quick emergency, HyperReach is the way to go. Folks, thank you for tuning in. We will do another one certainly next week. But in the meantime, we do update the Facebook page. We do update the town news, so you can always get the most up-to-date information possible. Please continue to be kind to one another. Be safe. 6 feet, masks, face coverings, and wash your hands. Folks, thank you very much for tuning in. Good day.